Joining me now is Dominic LeBlanc. He's the Minister of Intergovernmental Affairs, and he's also the chair of the government's Special COVID Response Committee. First of all, Dominic LeBlanc, thanks for joining us.
Well, thanks for having me on the program, Martin.
I mean, let's start with the press conference which you presided over this morning, the modeling, the latest federal modeling that we saw. The figures say that we could reach 15,000 deaths by Christmas, that with the current measures in place, we'll still be seeing up to 12,000 new infections a day by January. I want to ask you, when you sat there with the premiers yesterday, when you and the Prime Minister met with them virtually, did you share with them where the trends are going? Are you tempted to say to them, look, you know, this is not the time to be relaxing restrictions?
So, of course, Dr. Tam, Major General Fortin participated in the update, in the briefing that we had at the first part of the meeting with the premiers. And of course, we talked to them about the concern that I think all Canadians share in terms of the increasing numbers of cases, the tragic outcomes in many circumstances, but that's obviously shared by the premiers. The discussion we had, I think, was sort of what more can we do collectively? What can we do together? What can the Government of Canada do to support provinces and, most importantly, Canadians, Martin? If provinces want to make the difficult decision to lock down certain parts of their jurisdiction, of their provinces, or certain areas where the transmission rates are worrisome to public health authorities, the Government of Canada has to be there to support Canadians, as we have since the beginning of the pandemic, so that those measures don't economically create more chaos and more concern that necessarily they already have.
Okay, because the reason I ask, though, is, I mean, several of those premiers, I think there's only two provinces which have decided definitively now to continue, well, two of the large provinces that are the most affected that have decided to continue on with their lockdown or their restriction measures. They're all approaching a date where they have to decide whether or not to lessen restrictions for Christmas. I mean, do you weigh in on that and say now is not the time to be lessening restrictions?
So, no, we don't think that in those kind of decisions it's constructive to have the Government of Canada sort of intervene on what necessarily is their responsibility, what is their jurisdiction. But we certainly discuss, and Dr. Tam, for example, the Chief Public Health Officer of Canada, with her provincial and territorial counterparts, talk, I think, every day or multiple times during a week in terms of sharing data, sharing information, sharing best practices. So the conversations with the premiers was sort of along the lines of Canadians want our governments to work together, work constructively to protect them as best as we can. And premiers shared with each other some of the decisions they're making. So different premiers offered sort of suggestions in terms of what they think might be best practices. A lot of the discussion, Martin, focused on long-term care homes, on protecting elderly, vulnerable populations, seniors. Some of the most tragic outcomes have obviously been with respect to older Canadians, and particularly those living in long-term care homes. So a good part of the discussion was, how can the Government of Canada do more, invest more money, help share best practices from one jurisdiction to another, and try and better protect those that are most vulnerable. And we've seen, as I say, very difficult outcomes in many jurisdictions right across the country.
Well, that's where I was going next. I mean, the big story, and it's not a surprise to anyone, but the big story is that long-term care homes now are once again suffering the lion's share of deaths already as the death rates go up. In your economic statement, the federal government, your government, proposed $1 billion fund to help the provinces in long-term care homes. You said it would be especially for infection control. You discussed that with the premiers. Where do things stand now? For example, are you going to go ahead with the idea that to qualify for that $1 billion fund, the federal government might be asking for certain benchmarks or standards?
So we've said, and you're absolutely right, there's $1 billion that my colleague Chrystia Freeland put in the economic update a couple of weeks ago that is available now for provinces and territories that want to work with us in terms of common best practices. We don't see this in terms, Martin, of imposing standards. Many people see all kinds of conspiracies to impose standards on provincial jurisdictions. That certainly is not our intention or our approach. Our approach is to say, let's ask experts, as health ministers and public health officers from every jurisdiction already have, to try and develop guidelines, benchmarks, I think was the good word you used, And what can we do as a national government to help provinces and territories raise the standard of care to try and meet a higher benchmark, a higher standard of infection control, of infection prevention. A lot of this has to do with some of the vulnerable women and men who also work looking after these people in the long-term care homes. So it's a complicated and long-standing challenge, but we've said to provinces and territories, the government of Canada wants to be part of a solution that Canadians urgently are asking us to work on together. And we're prepared to invest, as you said. We'll start with $1 billion, but if more can constructively be used to improve the care of Canadians, of elders, senior citizens in these kind of living circumstances, then we'd be happy to try and help.
Okay, quick answer, because I have one last topic to deal with. But on that $1 billion, has any of that money flowed yet? How long before that money flows to the provinces?
So I would hope that one premier actually texted me this morning and said, look, how can I sign up for the long-term care standards, the long-term care guidelines? Like, what do we need to do to start working right away? So I would think at the beginning of next week, that particular premier and his health minister will be working with my colleagues on what collectively we can do to raise in that jurisdiction the standard of care offered to seniors living in these homes. And as I say, then the money's available now. We expect it to start to reach provinces and territories in the coming weeks. And I think you'll see many premiers and many territorial leaders, Martin, say to us, look, we want to help. We want to be part of this solution, and we want to collaborate. So I think it should be a very happy story on something that Canadians are very, very concerned about, and rightfully so. Okay,
last question. One of the big things coming out of the meeting as well, from the Premier's point of view, they're interested in health transfers. The Prime Minister has said, point blank, that he is in favour of Ottawa, your government, increasing Ottawa's transfers under the Canada Health Transfer. He says they need to be increased. When can the provinces expect some sort of specific number? When can they expect an announcement on an increase? Would it be before a spring budget?
What we've committed to doing, Martin, is to sitting down with provincial and territorial financial or finance department officials. You know, the starting point to much of the discussion is based on numbers and calculations that perhaps don't reflect the current reality. The premiers, when they talk about percentages and amounts of money, conveniently forget the tax points that the government of Canada transferred to provinces. We reduced, for example, by 13.5% the personal income tax, and immediately the provinces then took up that room in taxation.
But I guess the question is just a time frame.
Years ago,
right? But time frame. What is a time frame? Because we've gotten into all the minutiae of it, but is there a time frame?
Look, the time frame. First of all, we've already spent billions of dollars, Martin, supporting provinces in healthcare, and will continue to do so in expenses related to COVID-19. We started the conversation by telling the premiers that the over $1 billion the government of Canada has already incurred to buy vaccines and distribute them to provinces and territories will, of course, be on the back of the federal government, and they'll be free for Canadians. What we've said to them is that the worst economic recession in 90 years, and in the middle of a pandemic, it's sort of hard to look at the fiscal and economic circumstance 6 months from now, let alone 10 years from now. So that conversation will start, we hope, in the new year, and we're prepared to continue to transfer more money to provinces and territories for all of the costs related to COVID. And that's going to be our focus in the very short term. But of course, we're prepared to look with them at what are the longer term measures necessary to support high quality public health care.
Okay, Minister LeBlanc, thank you very much for taking the time.
Well, thank you, Martin. I appreciate it. Have a great weekend.
You too.